12:01, and we're going to start the meeting. I'm Eva Germain Shumatakahara, the president of the Coos Bay North Bend Rotary Club for the next 2 weeks. And then Tim Novotny will take over July 1st. We are going to put this on YouTube, and Bill Gryle is the co-host. And we will start with, Deanne, will you do the four-way test, please? Lead us in the four-way test. Unmute yourself.
I did it last week.
Go ahead, do it again. Okay, is it the truth?
Is it true? Is it the truth? Is it fair to all concerned?
Will
I'm sorry.
Will it be beneficial to all?
all concerned.
Got it.
And is your mic unmuted? That's the fifth of the four-way test.
Oh, sorry.
Okay. So, you want to put a plug in for the convention right now? We've got 21 people here, and they have to do it today. So, look.
Sure. Yes. Just a reminder again that today is the last day to sign up for the virtual Rotary International Convention, and it doesn't cost you a thing. And it will be an interesting, first of its kind event worldwide. Rub virtual elbows with Rotarians from all over the world, get to see some great programs and have some great fellowship. And if you get thrown off a little bit by the time change, there was some inclusion this morning, or maybe it was yesterday, that a lot of these programs are indeed going to be recorded, but you have to be registered to get the recording. So, you get signed up so that you will at least get a chance to get the recording so that you can enjoy it on Pacific Coast time, and, enjoy it with your family, your friends that are socially distancing in the backyard. You can pull the TV out and enjoy Oregon weather and watch the Rotary International Convention. But the thing is to get it registered today.
And Tim, there's also on Friday a test we have to go on and make sure that we can get on. They sent that out this morning.
Okay, I haven't seen that yet, but I will do that.
I'll wait to get back to work and I'll do it.
Good. Great. Okay, in that case, I'm going to introduce Elana Crane, who is the CEO of Bay Clinic. She's been there for 3 years. She relocated from Georgia. She has 2 children who are both becoming physicians, both in residency at the moment. She's a Georgia Bulldog, and she came here and came from humidity of 95 to 98%, and she now enjoys the 55-degree weather and rain, she says. So she's going to show us a PowerPoint on the Bay Clinic, and I'd like all of you to mute yourselves while she does that. She's going to be the speaker so we don't hear anything else. Okay, go ahead, Elana.
Okay. Okay, so I guess I'm up. So, so Eva, can you hear me?
Sorry. Yes, I can. I muted myself before. Okay.
Okay, all right.
We can all hear you, yes.
Okay. So, as Eva said, I'm at Bay Clinic. I've been here approximately 3 years, and I've been in this business for 30 years, and that's no reference to my age. So I'm going to talk a little bit about COVID-19 or coronavirus and how it has impacted and changed medical practices. So this first slide, it shows, we've gone from a doctor or nurse wearing a stethoscope, working, to now the equipment being the gloves, barrier gown, face mask, and goggles. So anytime that there's a possibility that someone could have coronavirus, being that they have the symptoms of it, the staff actually has to all these items for their safety as physicians as well. So with COVID-19, business was just we were just bumping along as normal. There was nothing to plan for. And then all of a sudden in March, with basically no warning, we're sitting here as a medical practice, a private practice, and we're forced to look at redesigning our business. Our medical practice, as I said, it's a private practice, it's a partnership, which means that it is actually owned by one of the physician partners. And so, we had to redesign ourselves and how to face a pandemic. And we really thought at that time in March that it would forever change every aspect of our business, from patients, their families, our employees, our vendors, our medical providers. Bay Clinic, we remained open the entire time. We've maintained normal business hours. Our healthcare providers just thought that this was the time that they needed to be available for their patients. And so in stating that, the volume of our patients coming in to be seen certainly changed from a physician that might see 15 to 20 patients a day. They were showing up for work and they might see 3 all day. Initially, the telephone calls were greatly increased. Our staff, they spent a lot more time on the phone because our patients they just had lots of concerns. They had a lot of questions. And so we worked diligently to provide answers to those. We've yet to return back to pre-COVID levels. Our patient volume reductions range by, I'll say by department. We have pediatrics, OB, family medicine, and internal medicine, and allergy. In those various areas, the reduction in the patient volume has been anywhere from 40 to 70%. Pediatrics is the hardest hit, and that's a national statement for pediatrics. Their volume is certainly down closer to the 70%. The big reason for that are kids are not in school. They're not passing around germs. Typically, when school starts, within about 3 to 4 weeks is when the school children begin to get sick. It's just enough time for the germs to get passed along and kids to start getting sick. And so we didn't really have much of a sick season with children. Children are not the ones that are primarily impacted by coronavirus. So we talk about our patients. We began doing telehealth services. We initially tried to do it with Zoom, but it just didn't work very well. And then we went to DoxyMe, and it works better, but it's still not perfect. All of these services that provide these remote services, they're inundated, they're overwhelmed. It's kind of like our business went down in March and theirs just went crazy, with additional need. So we're still doing the DoxyMe telehealth visits. We have found that they're decreasing. Patients, especially the adult medicine patients, are actually, most of them do prefer to come in to the office and see their provider, whether it's a nurse practitioner or the physician. We did make changes to our building. The only person that was allowed in the building has been the patient, and all patients are screened prior to entering the building. They're asked health questions, their temperatures are taken. If they're negative on all the questions and the temperatures are normal, they can actually enter the main integrity of the building. It's been, we've provided car service. When this first started, sometimes patients would want their blood drawn in the car. They might even want the physician to see them in the car, especially if they were immunocompromised, and we've done all of those services. We tried to be available to the patients as they would need us. We're still doing the COVID testing. We're actually doing more COVID testing now than we have done in the past. And part of the reason behind that is we do have more test kits, but all pre-op patients are required to be tested. So, you know, as the primary care providers, we're the ones that are providing those tests. So we've done 66 tests after May, and we did 130 before May. So that's sort of an indication that more tests are being performed. You know, we're still having negative testing. I think as far as, you know, any medical practice today, the secret is going to be flexibility to the change, because it comes fast. Excuse me. So the physical changes that we made to our building in an effort to keep our patients and our staff safe from exposure, with the goal to protect the integrity of the building interior. Because the way that our building is set up, we have a main building, a main entrance that people come in. And then from there, it breaks off into different areas. And so, you know, we considered the main area, the main integrity of the building. And we knew that we were going to have patients that came in that way, such as our OB patients. You know, they couldn't like become unpregnant, and they still had to come to the physician for ultrasounds and their OB checks and things like that. So what we did is we looked at the exterior entrances we had of this building, and we dedicated one area, an exterior entrance for the sick children, and we dedicated an exterior entrance for the adult patients. And so we currently still have that in place. You know, that's something that we're looking to evaluate. Do we still need to do that? We have really been fortunate in Coos Bay or Coos County, and that we've only had 2 positive cases, and we've had no hospitalizations for COVID. Let's hope that that trend continues. We're prepared, we're ready in case it does hit our community, but we certainly hope that we maintain this positive outcome. We did limit the staff that worked in the areas, the sick areas of the building. We took physicians that were over 60, and they do not go and see patients there in an effort to protect their health, or if they have any underlying health conditions. They do not work in the sick area. So, and having exterior entrances, you know, people have to go to the bathroom. So rather than having them come in the building, we put porta potties out there and hand washing station. You know, we're taking extra precaution and doing a higher level of sanitizing between patients. Our cleaning staff deep clean every night. You know, before we always wiped the tables down, but you know, we didn't wipe down the doorknobs, and we didn't wipe down the front of the doors and the things that people could touch. So we're still doing those sort of things. We do suggest that everyone entering the building wear masks. We can't require that because we do not have the supplies to provide that to people coming in the building. We are required to provide that for our employees, and they are required to wear masks if they're in a patient contact area. So at Bay Clinic, we do have a social health department, and that consists of traditional healthcare workers, and diabetes educators. During COVID-19, this department has diligently been working to ensure the health and well-being of the Bay Clinic patients, especially the vulnerable patients, such as the homebound, those having special medical needs, those that have mental health concerns, or even those that have been to the emergency department recently. All emergency department visit patients are contacted by our social health department to see, how they're doing and if they need follow-up or do they need anything. So through May, this department has provided 80 boxes serving 200, or since March, we began providing boxes to serve those patients. And through May, we've provided 287. We served 287 patients with 80 boxes. A lot of those boxes, we hand deliver those, or sometimes the patient may meet us somewhere. And these boxes contain such staples, and hygiene supplies, homeschool material, handmade masks are in there, food staples. We've worked with a local food bank, and we pick up food boxes from them and deliver to the patients. We have mental health services available at Bay Clinic through our behavioral health staff with counselors. We have one in pediatrics and 2 in the adult medicine department. They've been a little busier during this time because it's a very trying time for most people. I mean, those are, we're essential workers and we've come in and we've worked every day, but there are a lot of people who are working from home. All the children are home. There are people that have been furloughed or jobs terminated. So, we realize that it's a difficult time, and sometimes people need to be able to talk to someone and get a little bit of help. So we look at what is the financial impact that COVID has had, on medical practice, or really the medical community as a whole. As I said before, our practice is owned by non-physician partners. We're not a large, most practices are basically means we get rid of all of our cash is spent by the end of the year. We almost start January as a new business, and with zero money in the bank. And so, the way that we generate, the only way we do is by seeing patients. Patients generate charges, and the charges are filed to the insurance company. And then we usually see payment from the insurance company within 30 to 45 days. So we certainly have a lag from the time that we provide a service until we receive for the service. Of course, our largest expense, like most businesses, is payroll. March, with the COVID concerns and the reduction in patient volume that we saw, we made a very, very tough decision to complete our department, our X-ray department. If we weren't seeing patients, we weren't getting X-rays done. If we weren't seeing patients, we weren't doing referrals, and most of the specialists were not seeing patients, so we really didn't have anybody for the person to. So that department was closed, and it was internally assistance. Since March, we have added 3 staff positions. 2 of those have been rehires. One of the things that we also knew is that as our business began to grow and pick up and get more to what we would consider a normal business model, that most likely the positions that we would add would not come back in the same way that they left. And that these positions would be more hybrid positions. Like, for example, if we open our x-ray department back up, we're probably not going to want just an x-ray tech, but we're probably going to want an x-ray tech that has data entry skill levels, that they could do data entry whenever they're not doing x-rays. So, you know, we just felt like in the positions that we eliminated, and we used that word because the positions weren't going to come back in the way that they left. The telehealth visits, you know, prior to COVID-19, a telehealth visit basically paid us $23. I mean, that's not sustainable. We can't, you know, we can't do the work for $23 for a visit. And that's why most practices didn't offer those services prior to COVID-19. With COVID-19, the commercial insurance companies and Medicare revised the payment system during the pandemic, and the payments were increased, and most patient copays were waived. We hope that this will continue, but Congress would have to approve that. So that's sort of an unknown. So we look at, you know, we've been dealing with COVID since the middle of the middle of March. We're in the middle of June. We're still dealing with the repercussions of COVID. You know, like I said previously, Coos County has been extremely fortunate with the lack of positive cases, and we've had 2. We really don't count Shutter Creek. No hospitalizations. So Bay Clinic, we will continue to follow the from the CDC and from Governor Brown. We will continue to be a part of the community task force. We will continue to request PPE equipment, testing supplies. You know, one of the challenges that we have had is getting the PPE equipment and the testing supplies because everyone in the country needed them. And so we would put an order in, and until the order arrived, we really did not know what we were going to receive. You know, we might order 100 tests and we might get 10. And so it's gotten a little better in terms of the availability of test kits. They do have the fast, rapid test kits available now. We are a little concerned about the accuracy of those. We've learned that there's a fair amount of false positives. So usually if you have one of those, they'll want to do the swab. The swab that is actually used is the same swab that is used for a strep throat. So I think that Oregon has been the 4th lowest state with positive COVID-19. You know, you know, as Eva said, I'm from Georgia, and really any of us here that's from the East Coast have not been able to travel. You know, I have not been able to travel back to visit family for 7 months now, and I honestly do not know when I would be able to do that. Georgia's having almost 1,000 new cases a day, which is just unbelievable. So, you know, the things that we can say really are the same items that you've heard everyone say. You know, stay safe by staying home as much as possible. You know, don't gather, social distance, wash your hands in warm water with antibacterial soap. Don't touch your face, wear a mask for protection. So, you know, Bay Clinic has been here for more than 60 years and been a part of Coos County, and we remain dedicated to the health care of our citizens in Coos County. So that's it. So do we have any questions?
Yes, Elana, there are 3 questions in the chat room, and one of them I think you answered. Do medical providers get compensated less with telehealth appointments? You said $23. Is that what they get?
That's what it was before COVID started. And so now they have increased that, and it's more of a same reimbursement as regular visits. But we do not know if that's going to continue. That's sort of a question. You know, Congress is going to have to approve it for Medicare, and then the commercial payers are going to have to approve it as well. You know, most our adult patients, actually, most of them do not prefer a telehealth visit. You know, we offer that when they make an appointment. You want a provider, or do you want to physically come into the office? And so they let us know that, and then the appointment is scheduled accordingly. I personally, you know, I see a rheumatologist in Eugene, and I actually had a telehealth appointment with him, and I thought it was just wonderful. I'm hoping that it'll always be that way, because it prevented me from having to take a whole day off to travel, you know, 2 hours and 15 minutes to Eugene for a 10-minute visit and then, you know, drive back. So, you know, there are some advantages certainly with travel dynamics, but most of our Coos Bay, our Coos County citizens have preferred to travel to see appointments.
So Rick Rayfield has a question. Did you consider applying for a PPP loan to maintain staff?
We did apply for a PPP loan. And, you know, the PPP loan covered, it covered staffing of the current staff that we have here. It just did not cover all of the expense. You know, for your PPP loan money, you could cover, you had to cover a certain percentage of payroll, which had to be well, initially was 75%, and I believe they've reduced it down to 60 or 61%. But our loan actually covered 80% of our current payroll. And then it could cover your rent and your utilities and your telephone. So we did receive a PPP loan, and in 8 weeks, we have utilized the entire proceeds from the PPP loan forgiveness.
Okay, another question. If you closed your referral department, this is from Ed Meyer, how or what happens to a patient that needs to be referred?
The medical assistants with the physicians pick that responsibility up because they work directly with the physician. And so with the reduction in patient volume, they had reduced workloads. So that was picked up directly by them. At some point in time, whenever business certainly gets back to more of a normal, it may be that that department is recreated, but only volume will dictate that.
Okay, and Rick Rayfield has a question. Which reopening activities present the greatest risk to Coos Bay area?
If we were in a place other than Coos Bay, because we've only had 2 cases, I think the answer to my question would be different. But we all know that gathering is the #1 reason that people really obtain this disease. You know, and I mean, over 90% of the people that get this disease survive it. So, you know, it's especially dangerous for the older patient population or those with, they're immunocompromised. They may have diabetes or asthma, lung diseases. They certainly are at a greater risk. Children, you know, are typically not, there's a low percentage of children getting this disease. You know, we are finding those that get it are having some residual effects afterwards. But I mean, for the answer to that question for Coos County would be kind of, you know, just be careful, wear your mask, you know, wipe down your carts when you go shopping. be careful who you gather with. You know, if somebody's sneezing and coughing, and, you know, I probably want to stay away from that person. You know, so I think is in answer, you know, that's probably the best advice or answer to that question.
So anybody else with a question? You want to speak up, just unmute yourselves. There's a new message here. Let's see. Okay, from Tim. Has there been any chance to prepare for potential future challenges in the fall? What are the greatest concerns at this point? So
Well,
Tim,
we are prepared for future challenges in the fall. You know, with the task force that we all participate in, and that's Bay Area Hospital, Bay Clinic, North Bend, Waterfall, Coos Health and Wellness. You know, it's really all the entities that provide medical service. And so, you know, the plans remain in place. You know, nothing, we've not changed those. You know, the greatest risk that we have concern about in the fall or the early winter months is actually the reoccurrence of COVID-19 along with the flu. The flu was very, very mild this year. We did not see very many cases of flu here. So I think that's going to be, you know, we've kind of talked about that being our greatest concern, is what happens if COVID hits the coast, and what happens if it hits during flu season. So, you know, the only way we can prepare for that is make sure we have testing equipment and PPE equipment, you know, because it's just an unknown. Medicine has always been really protected. And this is the first time that medicine has not been protected by some sort of catastrophic event. You know, you think with a pandemic that, well, gosh, you know, medicine, that's where the meat of the business is. But it's been primarily, you know, we haven't had here. It's been primarily hospital-based for most places. But, you know, I mean, hospitals are losing $1 to $2 million a month right now. You know, so it's a huge challenge to open back up and try to remain, you know, what was your normality. We really think that the normal that we were accustomed to will never be the same as it was. And I know a lot of people hear about, you know, the new normal, and you kind of get tired of that a little bit. But in honesty, we really still do not know what the new normal is going to be. You know, we have a disease that 99% of the people that get it survive it, but we've closed our entire country down, you know, for a small percentage of people that are dying from it. And it's our sick, it's our elderly, it's the people that are very, very vulnerable. So there's kind of controversy sometimes about, you know, is this what we should have done? Should we have not done any surgeries? Should, you know, because Coos County has only had 2 positive cases, you know, since this all began in March, you know, should we be more aggressive? Should we open things up more? So.
And we've lost a lot of first responders as well, you know, frontline people. What about in terms of getting flu shots? At what point should people get their flu shots? I've seen some signs already out. Should people start getting their flu shots a little earlier than usual to try to mitigate that potential of getting it at the same time?
I would say no. Flu shots are typically given, they typically become given in most medical offices either in October or November. The thing about the flu shot is it has a short window. It doesn't last for 6 months. It takes your body a couple of weeks to get immunity, and then it only lasts, I'm thinking, and I'm not a clinical person, so this isn't definite, but I believe it only lasts like 3 months. So if you get it now, you really will not have immunity going into the fall and winter when flu usually hits. the flu that I've seen here the last 3 years has usually been in our winter months. You know, we'll start it in January or February. Sometimes, you know, not this past year, but before, the year before, it hit late. You know, we were having flu cases in April. You know, I think that's the greatest challenge that we have, is just, it's an unknown. We can't plan for it. You know, we have to have the flexibility to be able to change quickly. Because, you know, when you get something like we're dealing with now, it comes fast, and you have no warning, and you really have very little preparation at that time. You have to be prepared for it in the event it happens. And I think that our county is prepared in the event that we were to get, you know, a lot of cases and we were to get the pandemic. But I certainly hope that we remain healthy on the coast.
Thank you. So Dr. Shimatakahara has a question. Are you currently ramping up your clinical activities? And if so, what steps are you making to publicize this?
We have not made the decision to wrap up. When he says our clinical activities, I'm not sure.
You want to speak to that, Stephen?
Yeah, because clinically we've remained open. There's nothing that has actually changed clinically in our practice. We've maintained normal business hours. The challenge that we're looking at now is, do we continue to have exterior sick entrances for children and adults? Do we maintain that level of protection for the patients and families? Or, you know, with having 2 cases in Coos County, do we remove that and absorb that space back into our office? And what was the other part of the question, Eva?
What steps are you making to publicize that you're opening, if you are opening?
Well, we never close, so we're not really doing any steps to publicize it, because we never closed down. Our hours never changed. Our doctors came to work every day. I mean, you know, to have a doctor that comes in and is used to seeing 20 patients a day and they're seeing 4, where do you think they wind up? In my office. You know, it's like, you know, doctors are not meant to be people that aren't busy. They're highly functional. They're very busy, and it's kind of the story about idle hands. You know, they just do not do well when not busy. So I hope we get back to business as usual, or as normal.
Stephen, do you want to speak to that? To your question? You have to unmute. There you go.
Yeah, so we did close down for routine services and stayed open for emergency services at North Bend Medical Center. And now we kind of look at this very low caseload in Coos County as an opportunity, because it may change in the fall, but certainly throughout, you know, the summer months, we expect that, or we hope that this very, very low caseload will continue. And so, you know, for instance, I recently
Mine's tomorrow.
And to do things like that. And so we want to improve, you know, the traffic in our clinics. And we're instigating kind of a public relations campaign to tell people, you know, it is safe. It's safe to come in, and these are the measures that we've taken to make sure that you will be safe.
Right.
I think that in many respects, you know, one of the reasons why Coos County's caseload has been so low is that people have taken it very, very seriously. And so when you go around town, there are any large gatherings, people masks and wash their hands and all those other things. And so all that social distancing, the mask wearing has had a positive effect upon, you know, the local disease rate. And
Absolutely.
I think that in some respects, we may have overshot the target, but that's not a bad thing. I think it's just
No.
important now to like reassess and to take advantage of this really just it's kind of a golden moment here, and hopefully people can, you know, be serviced and have services and get their haircuts.
Absolutely, absolutely. Like I said, I think we're very fortunate in Coos County to only have the number of two, and we were prepared. You know, you guys were prepared. You know, we were all prepared for these vast numbers, and fortunately, I mean, it's great for the community that we didn't have to instigate a lot of the, but. We go into Safeway and people that have on their mask. So I think that we really well in terms of that. And, you know, we do not know what to expect in the future. Didn't expect, you know, you look at the middle of March and no one expected the middle of March for just out. It's the same in terms of planning. It's kind of like Murphy's Law. You know, you hope for the best and you plan for the worst. And I think that all of us are in that capacity to do that. But we certainly hope that, you know, the community continues to stay safe. You know, I think the one thing that I've heard the most, and especially in terms of referring patients, are, you know, people need to be there to answer the phone. You know, sometimes you know, I've heard like, you know, somebody will say, I'm in the office on Tuesday, please leave a message. And then you leave a message and you don't get a call back on Tuesday. So then you got to call and leave another message. And you hope that you get called in a week. So then you've gone 2 weeks. So I think the biggest obstacle to overcome really is accessibility. You know, we were inundated with phone calls initially, and they were quite lengthy phone calls with our staff, but we've seen a huge change in that. So, so I mean, we're, you know, like I said, we're doing well, but we're prepared. You know, we're all prepared in case it hits. And I think it's something we'll have to live with forever. I don't think it's just going to go. I don't think we know enough about it. You know, I read about, you know, how the virus is mutating. And so I think it's going to be something that sticks around, and we develop of it in our. I'm happy with where we are with 2 cases. You know, it's been a very challenge business-wise, as I'm sure that, you know, you guys have experienced the same thing. But, you know, we just have to dig a little bit deeper and find a way to make it work, because we don't want to lose any of our providers. You know, we worked too hard to get them here in Coos Bay and North Bend. So,
Elana, thank you. Anybody else have a question for her? Just raise your hands if you do. There's one from Jim. Jim, let's unmute yourself. You need to unmute yourself. I'm trying to unmute you. So Bill, I can't seem to unmute him. Jim, you need to unmute yourself with the little red thing there. There, good, great.
Okay, well, I was trying to hold the space bar down. Apparently it didn't work. I've been reviewing the national statistics, and my wife and I have some background in immunology and microbiology. And it seems to me that we have done a lot of the things to suppress the COVID virus of washing our hands and so on. And that has also suppressed other diseases and the other flus. Mm-hmm. Has caused them to be much less. But as you look at the national statistics, it appears to me that we're going to have a big backlog of untreated problems or potential problems mm-hmm. that are going to come upon us. The other thing that happens with immunology, if you don't challenge your immune system along and keep it going, it becomes weaker. So at some point in the future, I really think that we possibly are going to have a real spike, not just in COVID, but in regular flu and other diseases. Has your clinic share that idea, or have you talked about that, or do you have any plans on that?
Our physicians have discussed that. And, you know, that's one of the reasons that we're trying to sort of stock up on all of our PPE equipment and supplies and testing, try to get enough volume that in case that does happen, we're prepared for it. And, you know, I mean, you're absolutely correct about, you know, where has the heart attacks gone? Where have the stroke patients gone? You know, I mean, the hospital has not been seeing the volume that they normally would see for just regular sick people. You know, so you wonder, it's like, okay, it's been 3 months, where, you know, where are those people? Did life get simpler and people are less stressed? I mean, you know, it's something we really don't know. But, you know, in terms of being inundated, you know, we do worry, especially about pediatrics. You know, those children need their well child checks. They need their immunizations. You know, 3 and 4 year olds need them to go to school. We are making an effort to call all of our 3 and 4 year old patient parents, you know, about trying to schedule them to come in and get their immunizations and not postpone them. It's the same thing with your newborns. You know, they need to come in and be seen and make sure that they're gaining weight and then get their vaccinations timely. So we do have concerns about that because the greatest reduction in volume has been in pediatrics, and that has been nationwide. It's not just selected to our area. You know, and ironically, our adult patients, who oftentimes are the most immunocompromised, are the ones that want to come in and be seen. So it's been sort of a reversal of what our expectation would have been. But we certainly have talked about it. You know, we do have concern about it. We are preparing to be ready if that happens, because it certainly can happen.
Thank you. Thank you, Jim. Another question? Gonna unmute.
Just another thing, in my looking around and doing some research and stuff that I've been doing, I've noticed that there's a great deal of increase in, I don't want to call it anti-medicine, but the anti-vaxxers are certainly active. And
They are.
Boy, that worries me too, concerning herd
Right.
immunity.
It is concerning. You know, anyone that's really, you know, you're familiar with immunology, and most physicians and most practitioners, you know, they're all gung-ho vaccinations because it saves so many children's lives. You know, in the big scheme of vaccinations, it's very beneficial to vaccinate. And same thing with, you know, getting the flu shot. Some people are very supportive of getting it, you know, others are not. You know, some years the flu shot, they get it right and they have the right strain, you know, and sometimes they don't. You know, it's sort of an educated guess as to what we're going to face. So medicine, you know, I think, you know, I kind of look at it sometimes as, you know, they talk about medicine being an art form as well as a scientific method, and it truly is a little bit of both. I mean, it's art and science, and you know, sometimes science wins and sometimes it doesn't. But we just have to be aware, we have to be available, and we have to be prepared. And that's really the best that any of us can do in terms of what if, what might happen, what might we be faced with, because it certainly is an unknown.
This is Rick Rayfeld, and more of a comment than a question, especially since we have a couple of people that are on the task force for the Bay Area. And that would be, as well as Stephanie, who's in the media business that's with us, is perhaps considering or discussing a advertising campaign to encourage people to come back and get their routine care, as you point out, especially pediatric patients, vaccinations, other routine care, because from some of the national reading, there seem to be a lot of people who are somewhat still reluctant to come back,
Right.
concerns about safety.
Mm-hmm.
And advertising is a way of
It's a powerful
changing
tool,
that
right?
influence. So
Definitely.
maybe that would be something that focused in our Bay Area here rather than at a national or state level would
Correct.
be more effective.
Yeah, Bay Area Hospital is looking at doing a similar project, and Coos Health and Wellness has talked about doing a similar project. So,
But I would encourage both of all three of the major clinics in town, if you would have the opportunity to participate or have your logos involved with that, it would broaden the message, because especially your patients for each of the clinics will pay attention to that.
right.
So thank you.
All right, thank you.
We have started on that type of campaign.
Right, yeah. Yeah, I talked with John Burles yesterday, and we had discussed that as well. Yeah.
I missed the first part of Rick's comment. I was carrying a case of paper in the office. This is Stephanie Kilmer, and I am at KDOC. And if there's something that our media expertise can assist all of you with in some sort of a campaign, I would definitely provide some people to do that as well as myself.
Okay.
Thank you, Stephanie.
Definitely, yes. Anyone else? Questions, comments? Gotta.
Eva, unmute yourself.
We saw your mouth moving.
Right. Okay, Tim, do you have something to say there?
No, I was just telling you you were muted.
Oh,
Yeah.
playing. Okay, I'm trying to watch the chat. I'm trying to watch the people. I'm trying to get rid of all these.
I was miming you.
Okay. All right. Well, I have a. You see this? Can you see this? Oh yeah, you can. Right, okay.
Yeah, absolutely. Yeah.
Okay. So Deanne and I are selling these for the club, and we talked about vaccinations, and these go to Polio Plus, which not only does polio, but also other communicable diseases across the world. So we have a number of these to sell, and they're very good for walking on the beach. I put this in the newsletter, or for walking or hiking or going downtown. You can put everything in it, including your keys, your license, your water bottle, reusable, and you don't need to take a purse for the women, you don't need to take a purse into the shops. You just have this and it's slung around you and you get into it easily. So we want to sell these. They're $15 each or two for $25. So please contact either Deanne or I if you want one of these, because they're made from recycled water bottles too. Boy, this virtual reality has a whole bunch of stuff. All right. Okay. Anything else, anybody? Yes, Jim?
Yeah, I just had a comment. I don't know if any of you take the registered guard, but this morning there was a big article in there about Bill Gates and vaccination and so on. On one of the sites that I got into, the anti-vaxxers, they're really blasting Bill Gates. They're really blasting Rotary and so on for promoting vaccination. So if you have access to registered guard, you might read that article just to have some ammunition to know what the truth is.
I saved it. I've got it right here. I
Oh,
read it.
Yeah.
Yes, well, there's some nasty sites out there on the internet, I'll tell you.
Mhm.
Yeah.
Really blasting the vaccination programs and Bill Gates in particular.
Yeah, and Bill Gates denying. I mean, of course, he doesn't want to microchip everybody. I mean, it's
Yeah.
kind of ridiculous, really.
Yeah.
Inform yourselves. That's a good point, Jim.
Get your sling carrier. Okay.
Yeah.
Thank you guys for having me. I appreciate the opportunity to speak to you, and I hope that you know, you enjoyed my presentation and sort of understand the private practice a little bit better or more. So just you know,
Thank you so much.
social distance, do all the things that, you know, we're supposed to keep doing. So
Thank you.
We're happy to have you in our community.
Thank you.
thank you. I appreciate it.
Thank you. Okay, next week, everybody, we're going to have the director of the Marine Life Institute speak to us about what they're doing out here in Charleston. Yeah, so, and we also have a board meeting on Thursday. If you want to attend that, it's open to everybody. I can send you the link for the Zoom for that. And if you have anything you want to put on the
I
agenda,
sold 4 carriers yesterday.
great.
Slings.
You
And
want to-
we have a virtual Rotary International Convention at 6 a.m. Saturday and Sunday morning.
I'm registered.
Tim, I'll see you there.
Yes.
A
Yeah.
bunch of us going to that.
I'll have my eyes painted on my eyelids.
And a Mai Tai at 6 in the morning.
Yes.
Oh, there's her lay.
And a mask.
There's a big clam tide Saturday and Friday and Saturday, so.
Oh, boy. Okay.
Well, get registered. You can watch it later. You can watch the highlights after you. As long as you're registered by today, you'll be able to watch anything you miss. They'll have on playback later on, but you have to be registered.
And
I
there's
got
also
into
on
my
Friday.
granddaughter's stuff, and I've got lots of these.
On Friday, you need to go on and make sure that you can get on. There's an email that came out from the
Yeah.
district.
And they suggest you use Chrome. So if you have a Chrome browser, you're good. If not, you probably want to download a Chrome browser to use for these international convention events.
And if you take the walking challenge, you might win a trip to Taiwan.
All right, that's next year. That's the next year convention.
Yeah, let's hope it happens next June.
Yes.
Okay, anything else from anybody? Thank you all for being here. Thank you for being Rotarians. Okay, good to see you, Stephanie. We don't usually see you.
We'll see you Thursday at the board meeting and then next week.
Okay, thanks everybody.
Good reporting, Stephanie, out at Sunset Beach.
Yeah,
Thank you.
you should win a prize for that. I've been telling people you really should win a prize for that.
I got the KDOC Emmy.
Yes, I just want a
Yeah.
child's cheeseburger happy meal with a large regular iced tea. The largest you have.
That sounds like Lori Brooks. I'm going to end this. Lori Brooks.
I think the meeting
I'm
is
thinking
over.
that would be a great prize right now.
Good prize.
Let's do
Oh, that's a great one.
regular fries and apple.
Regular fries. Okay.
I guess this just shows you that you can do Rotary anywhere, anytime, including
Have a
the
good
drive-through at
time.
McDonald's.
Lori. Oh, Lori. Okay. This is great. It's one of those blurb funny ones. Okay. Thanks, everybody. I'm going to end it.